Welcome to another Spotlight video where we walk you through a spotlight figure from your textbook. This video walks you through the synovial joints spotlight found in Chapter 6. After watching this video, you should be able to describe the structure and function of the 6 types of synovial joints. Knowing this will not only help you understand how joints work, but also appreciate what happens when joints are injured. The structure of a synovial joint determines the direction and amount of movement it allows. In plane joints, the bones' flattened surfaces glide across each other in a single plane. Think of your sternoclavicular joint, where the ends of the sternal manubrium slide back and forth with the clavicle, allowing only subtle movement. Hinge joints, as in your elbows and knees, allow angular movement in one plane, much like the way a door opens and closes. Condylar joints, also called ellipsoidal joints, have an ellipsoidal or oval surface articulating with a depression. Condylar joints, like the one in your wrist, let you move in 2 planes. Think of a saddle joint as a horseback rider sitting on a saddle. The only saddle joint in the body occurs where your trapezium articulates with your first metacarpal, allowing your thumb to swing forward and oppose your fingers. Imagine life without an opposable thumb. A pivot joint allows rotation around an axis. For example, your atlantoaxial joint between your first 2 vertebrae, the atlas and the axis, allows you to rotate your head no. A ball and socket joint with bony ends shaped just like it sounds allows the most movement of any joint. Think of how flexible your 2 ball and socket joints are, the shoulder and hip, compared to the other joints of your body. In summary, synovial joints come in 6 basic configurations, and their shapes allow for movement ranging from slight to significant. So what? Why is it important to understand synovial joints? Well, you can apply this knowledge to understanding joint injuries. Forcing joints into unnatural positions can seriously damage them. And understanding how an injury occurred can tell you which structures are injured. For example, suppose someone jumps for a rebound under the basketball hoop and lands on a teammate's foot, rolling the foot and forcing excessive ankle joint inversion. This damages the lateral aspect of the joint capsule and causes an ankle sprain. But if the foot were forced outward into excessive eversion, the tarsals can be pressed against the fibula so forcefully that it breaks. This is a broken ankle and usually occurs just above the lateral malleolus. In both cases, the lateral ankle is painful and swollen. But is it sprained or broken? You won't know unless you ask the patient how the injury occurred and rule out a fracture with an x-ray. You don't need a traumatic event to damage synovial joints. Repetitive actions like pitching a baseball or even typing on your cell phone can cause joint injury. Over years, the articular cartilages can wear away until the raw ends of the bones painfully rub against each other with every movement. The gradual breakdown of the cartilage is osteoarthritis.